I'm going to talk about two areas today. One is the Raha, which is the remotely accessible healthcare at home model, which we have built in Saudi Arabia. And the other is a little bit about pharmaceutical marketing. How many doctors are in the audience? Any physicians? Okay, great. Pharmaceutical marketeers? Okay, more than doctors. Nurses, healthcare professionals, others? Okay, a few. Okay, so, and I've been told that, I don't have much time, so I'll try to be very quick, and I'll be speaking in English, so I understand that that can be a challenge. So this is always my first slide. Why do we exist? So whatever we do in healthcare is actually for the patient. It is not about technology. It is not about anything else other than the patient. This is my personal mission statement. And as you can see, it revolves around technology. And I request and urge each one of you to write your own mission statement in healthcare. We know who this is, but look at what he says. I think the biggest innovations of the 21st century will be at the intersection of biology and technology. Although he did not get time to work in digital health so much, but he did have the vision to see in the future that this is going to happen and not in the late future. So, just summarizing with a few, diagrams what digital health scenario today is, and I'm going to elaborate upon that more, inshallah. Just to remind you that the new rules of healthcare in the 21st century actually revolve around patient centricity. So everything we do in digital health has to be patient-centric. If it's not patient-centric, then we are losing our focus and it will not be successful or sustainable, which is the topic. So where are we today? We have mobile-based, web-based telemedicine, e-physicians, e-patients, the shift from hospital to home care, essentially due to technology, wearable sensors to actually insidables. FDA released just recently a drug which has a sensor on it, and you can actually take that drug and it will help you in medication adherence. Mobile apps, precision medicine. How many of you know what precision medicine is? Okay, 1, 2. Precision medicine is basically, it revolves around your genetic, predisposition, having, same disease, but taking different medicines. It's a whole different ball game. And I spoke at this conference in San Diego a couple of months ago of precision medicine and digital health. Health portals, big data, we talked about that, although I could not understand Turkish, but I could gather a few words here and there, 3D printing and virtual reality. So this is where we are today. This is not where we are going to move in the future. We are already doing it. A lot of it is already there. One of my favorite slides, how many have seen this slide before? Maybe I put it up, last time. So if you look at the date, which is 1924, how many were born in 1924? Obviously. So, but imagine, today we are talking about digital health. We think that we are very smart and we live in the era of technology. Imagine people living in 1924 when the TV also was not, there. There wasn't a TV in our houses, but they had the vision. So there were crazy people out there, maybe like us, who had this vision that in future, sometime in future, patients will be seen by the doctor through some kind of technology. They had no idea what that technology would be, but still they knew that technology will play a role in healthcare. And this is what we are talking about today. So these are the different models of telemedicine we are currently using. Different models, and we can obviously have a workshop on that actually. These are different devices. This is one of the best ones which I have come across, which is a hardware-based solution. It's called Dictum Health. I'm also their key opinion leader because I have found it to be a very robust solution. But if you're looking for a cloud-based solution, that's an entirely different story. So I'm sorry this is not working well with me, but I'm trying. So this is where we are All physicians are not, regular physicians anymore. Physicians are either Google physicians or e-physicians, whatever you can call them. This is Dr. Eric Topol in the US. He's a cardiologist, and he has not used a regular stethoscope in the last 3 years. He works in the US in a very regulated environment, but he has not, because he's using these devices. Dr. Shafi did the world's first virtual surgery in UK, which was seen and witnessed by 60,000 people. So we are already here. We are already here. Patients, 75% of patients, before they go to the physician in the US, they have already been on the internet. So they know what treatments are there. They know what medicines, what diagnostic tests are out there for themselves and their family. So we have the 3D printing. I think we all are aware of the revolution which the 3D printing has brought. Look at this. We have devices which can actually capture pretty much all kinds of information from here to here. You just keep using your wild imagination, and there are devices, there are ways of capturing data from the patient live in real time, like this. And we are using this in our project. So today, how many of you use Uber? Pretty much everyone. Although I have not used it, but I know how it works. I tried it a couple of weeks back in Jordan when I was in a conference. Didn't work for me, but I know how it works. So today we are in the Uberization state of healthcare. Data, everything is aggregated. And this is the revolution which has taken place. So our model, which we built in Saudi Arabia, this is the world's first of its kind connected health model. Connected health, as you know, is that we want to keep patients connected with the hospital and the physicians 24/7. So it's a continuum of care using technology. And it is not only for monitoring or treating, but educating, engaging, and empowering patients. And we are currently doing that at King Saud University, which is the largest university of Saudi Arabia. It's a very big project. As I said, it is the world's first of its kind, and alhamdulillah, we've developed it. So I'll just show you the video. It's a 2-minute video. Technology platform, and when I say was first, all these technologies are integrated into one platform. This is an encyclopedia, both in English and Arabic. It is available there. We are monitoring all these levels 24/7 of the patients who are at home. We are using webinars to engage with our patients. There is an emergency response center, so all patients are connected with our hospitals. We're using telemedicine, whenever the patient needs it. Patient does not have to come to the hospital. Like I said, different devices, all integrated. So whenever you're using a device, it pops up, the information comes up on the mobile and our portal immediately. This is the dashboard which the doctor or the nurse looks at from anywhere in the world. We have apps, portals, both for doctors and for patients. These are separate apps, again on both platforms, iOS, and this is our telemedicine platform. The emergency response center, so the nurses have a visibility of the patients, whatever is happening with them. So Raha, remotely accessible healthcare at home, has become, as I said, the first of its kind, where we are monitoring, we are treating, we are engaging with patients. A recent example, the bariatric department, you know where bariatric surgery is for very obese patients. So they reached out to us and they said, we want to use Raha for our patients. And before Raha, they used to keep the patients 3 days in the hospital. As soon as the Raha program came in and they put their patients on Raha, they discharged the patients the same day and then keep the patients for 10 days on Raha. And we are monitoring those patients. So imagine the amount of money we are saving the hospital per day into 3 days into per patient. So we are not only helping patients, but we are saving money for the hospital as well. So as you saw, these are our strategies. And I can show you the app. I have my app with me, and I can monitor my patients right now, or the physician can do it from anywhere. I can do telemedicine from my mobile / my laptop. That's how connected we are. Like I said, this is the world's first totally digital stethoscope with a good sound. Yeah, I think we have gone through that, so I'll just skip. Okay, great. So we've seen all that. Right, now let's, and I believe that we'll have questions offline during lunch. We don't have time for that. So now just, very briefly going through how digital has actually transformed, the pharmaceutical marketing as well. And today I wanted to not tell you that what we can do in future. I wanted to give you what we have already done and how we have utilized technology for us. So after the Raha project, now I will take you to another journey of how we are using technology for physician and patient engagement. And we are also getting the ROI, the return over investment and the return over engagement. So these are the challenges which you all face today. We want to add value in this space. And how do you add value? We want to make efficient, effective, and engaging relationships between physicians and patients. Now this slide, actually, this is the first time I have shown this slide in a conference. And if you look at this chart, you know that the pharmaceutical marketeers started working in this space. So this is value addition, and this is innovation. And marketeers would understand that the easiest thing to do is, if you allow me to say it, just bribe the doctor. You don't need to come up with any kind of marketing strategy. Just bribe the doctor, which is now prohibited in the US after the Sunshine Act, not so prohibited in countries like Pakistan or India or Bangladesh. Still, a lot of bribery takes place. Very easy. You just give bribe to the doctor and he starts writing your medicine. But it's not sustainable at all. Because if I give $1,000, there's another company which can give $1,500, and then it's an unending, So there are companies which are adding value, but they are not showing innovation. So what happens to them is that they become stagnant. Although they are not in this volatile quadrant, but they are not innovating. So they will become stagnant, and other companies will actually bypass them. There are companies who are innovating in these areas. There are new ways of engaging physicians for personalized services. So they are getting ROI, but again, it's not sustainable. So the only sustainable quadrant is that you have to add value to the physician and the patient and the healthcare ecosystem, but you have to innovate as well, and it cannot be personalized. And that's where the paradigm shift takes place, and that's where sustainable physician engagement takes place. And you get ROI as well, and we have done it, we have shown it, and today I'm going to show you the case study. So this is the quadrant where you need to be, which is actually a patient-centric quadrant, as opposed to a physician-centric quadrant, which is all about the physician. And I told you that today, it's not about physicians anymore. So this is a case study of a pharmaceutical company. And as I said, some of you are from the industry. And this company actually embarked upon the journey of utilizing value additional services, no bribery, no personalized services, yet this is the fastest growing company in Pakistan with a growth rate of 33% pretty much every year, whereas the industry rate is 18%. So it is a case study. And technology is one of the areas how they have done it. This is the menu of all different technology solutions they have come up with for physician engagement. So this is the first of its kind patient portal for obese patients. This is a webinar portal developed for physicians, and I'll show you how we are using it. This is one of the advertisements, early advertisements showing that 25,000 healthcare professionals have been reached through that. And this is the model. This is a professor of gynecology who never used to interact with this pharma company, never. And after these value-added services, we built a complete webinar platform as well as an app for him so that he could interact with all the gynecologists and obstetricians from the country. And afterwards, he started prescribing big time. And he's using the webinar here. These are different. This is a professor, the president of Pakistan Orthopedic Association using the webinar. This is a multiple session webinar. So 4 speakers from different parts using the same platform, engaging with doctors all over. Again, multi-center, speakers presenting. The second project, telemedicine. So we built the first virtual hospital of the country, where we were actually, putting up clinics. So doctors who want to do telemedicine can come on this virtual hospital and create their own virtual clinics. And all of this is done, as I said, through pharmaceutical support, but with an ethical perspective and value addition in mind. He's a professor, actually the president of the Psychiatry Association. This is a director of a large pediatric teaching hospital, interacting with a junior doctor from another hospital using our platform, which I showed you earlier. Then we established eye clinics all over the country, where we have this kiosk for patient education in the clinics. Very simple, not very innovative, but very effective. Then we started doing social media promotion for physicians, patients, and in healthcare. And these, 2 became our, I'm sorry, but it's just, so these are the social media promotions which really helped us a lot. Again, we came up with a new idea of every conference should now have a conference management app. So in Pakistan and outside Pakistan, we are using for every conference so for example, if we had a conference app here right now, you could have asked questions, to me through that app, or you could have interacted with each other, sending messages, looking at the profile, looking at my profile, looking at the program, making your own agenda. This is what we are doing in all these different conferences. And look at, we have done it in Sri Lanka, Kenya, Myanmar, Pakistan. All these conferences are now, and look at this, these pharmaceutical girls, they're carrying this and promoting the app for the physicians to log in and register and start using. So various examples of the conference management app. Okay, then we realized that doctors need to have an app through which they can look at the drugs. There are like thousands and thousands of drugs. So we came up with this app, which is called e-drug index, and now they can have access. Again, a very value-added, innovative service, no personalized service to the doctor. Healthy Plate. This is an app for the patients. It's not for, okay, I'll follow the time. It is not for the physicians, but it's given to the patients by the physicians. So patients who are diabetic, they can actually create their own healthy plates. And we have put a lot of information in this app as well. We have Preg app for pregnant ladies, so the gynecologists can give this app to their patients through us. The last is that we realized that, okay, we have so many digital solutions. How do we educate and teach our physicians to use them? So we came up with another app which has all those projects within it. So this is kind of an e-detailing app. So we are e-detailing the physicians that these are the various projects you can be part of. This is the information, and we show them videos from the app. We send them PDFs or PowerPoints directly from the tablets or the mobile application. So with that, I will close. This is my information, and I would be happy to interact with each one of you at lunch and discuss options and answer questions. Thank you very much.